So my name is Scott Grentell. I'm the Manager of Clinical Coding Services at Western Health. I've been with Western Health for almost 10 years. I've been the coding manager for around 2. So a clinical coder is in charge of taking a medical record when it's completed, reading the notes in their entirety and abstracting the pertinent principal diagnoses, additional diagnoses and procedures, and then translating them into alphanumeric codes. Those codes are then grouped together and they produce what is called a DRG, a diagnostic related group. And those diagnostic related groups are used to fund organisations, to plan services, for research, for disease tracking, all sorts of really important factors really. If we don't get the coding right, we don't get funding, we don't get the appropriate resources allocated to us. A lot of the work that the clinical staff are performing goes unnoticed. So those valuable resources which should be going to our area get allocated somewhere else. To have a successful clinical coder who is work ready, it is absolutely essential that they have access to live medical records to practice on. That will build their skills, it will make them more work ready, it will allow them to basically go to their job on the first day and know exactly what they've got to do. VU Polytechnic is focusing more on creating coding specific skills. So it does give a holistic sort of overview of the health service and where coding fits into that. But it also really gives that practical experience, the exposure to actual medical records, and that is what is really needed in order to provide that skill to clinical coders so they're more competent and work ready when they are ready to go out and get their jobs. This course, I think, will give you a very good base knowledge with which to use wherever you choose to work. It will also really give you those base skills that you need, such as abstraction. Like once you've got your abstraction skills, you can almost go anywhere and use those skills. And as the classification system changes over time, you can use those skills. That's one thing that you'll always have under your belt. A lot of the positives of an e-learning environment would be that is how you currently work. So most organisations, with the exception of a few that still have a paper record, all have either a scanned medical record or an electronic medical record. So you'll be training in that sort of environment, so that when you come out of the qualification, you'll sort of already have that sort of technical savviness, or even just basic exposure to an electronic medical record. Also, I think the benefit of doing it this way is that you get sort of instantaneous feedback. You don't have to, submit your answers to your coding cases and go away and wait a week for your feedback. You get that feedback straight away. So if you have made a mistake, it's fresh on your mind and it's easier to not make it again, or to take that knowledge and absorb it. The job opportunities in the western suburbs are going to be enormous, and in addition to that, there's a desperate need for clinical coders in regional areas. And as we go to a more electronic-based health system, you might be able to work from the country for a hospital in Melbourne or vice versa. So there's no restrictions on basically where you have to be to code.